Oh, okay. Okay, is that better? Okay. 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 Well, hello. Thank you for coming. I'm Dr. Melanie Kessler. I'm a physical therapist who specializes in pelvic health. I currently work here for Trinity under contract. But today I'm going to talk to you a little bit about what pelvic health physical therapy is. Before that, though, I'm going to tell you a little about myself. So this is my Christmas card from this past year. Up in the top left, that is my son, Oliver. He's 14 months old now. And this is my husband on the top right, or bottom right. I went to University of Florida for my undergrad experience, and so go Gators. Not much of a basketball fan, even though I went to Duke for my doctorate in physical therapy. I'm much more of a football fan, but I'll I get to celebrate the Gators this year. So anyway, at Duke, I specialized in pelvic health and had my rotations and took courses in Herman and Wallace. So they're the main pelvic health organization with physical therapy. Does this thing keep going in and out? I'm sorry. Okay. So today what we're going to be talking about is what is pelvic health, and then what is pelvic health in a physical therapy setting. We can talk about some of the common issues that we see in pelvic health, as well as those who can benefit from it. I'll give you guys a little bit of an anatomy lesson, so there will be a test at the end. Yeah. All right, and then before we get to questions, I'll just talk a little bit about some myths and misconceptions about physical therapy in regards to pelvic health. So, to get started, what is pelvic health? Pelvic health, in a general sense, is three main big things. It's bladder, bowel, and sexual function. But that's a very generalized term for all of the different things that we see. A little bit of a history lesson. Pelvic health used to be called women's health, but it wasn't encompassing all of the different people that we would see for the different stuff, so we changed the name to pelvic health. However, then we had a problem because there are some women's health issues that are not related to the pelvis, but we were still seeing. So those can include like oncology with breast cancer is another really big area of focus that we have, and lymphedema, which is often associated with breast cancer or other types of cancers. So some common issues that we see with the bladder and bowels specifically, incontinence, so that's leakage. We can have urgency, and urgency is basically like when you feel like you're not going to make it to the bathroom. And it's like comes out of nowhere, really big, strong panic urgency, right? We always have the feel that we have to go, but sometimes it's just a little bit much. That's what the urgency is. Frequency is just going too often, right? Like you feel like you have to go every 15 minutes and you always know where the bathroom is. So, and then you can have the opposite problem. You can have trouble going at all. Like sometimes it feels like you just don't quite get it all done in the first go. So these are all different things that we can treat when it regards to the bladder and the bowel function. We also focus on sexual dysfunction, and that can include dyspareunia, which is pain with intercourse. It can include erectile dysfunction. It can include prostate issues, and all of those sorts of fun things. So we also, lastly, kind of focus on chronic pain. Chronic pain can be related to any of the things that we talked about before, and it can just be pain in the pelvis. But because the pelvis is in an area that's very condensed and full of very important vital organs, it can also include pain in the low back and the hip because they're very close together, and oftentimes you can't have one without the other. So who can benefit? Anyone with a pelvis. We see any age, any gender, male or female, doesn't matter. We see it all, except maybe newborns. That might be a bit too early, but. So how physical therapy can help, it's just like any other physical therapy. We focus on function, pain, and quality of life. We want to make sure that you're able to do all the things that you want to do and it doesn't impact you quite as much. The only difference is that we focus on one singular area. And there's various interventions when it comes to pelvic health. And I was wondering, like, when I was making this presentation, how do I encompass all of the different things that I might address? So I'll just go more broad and say that we do things like strengthening and exercises. We do relaxation and stretches. We do manual work, soft tissue manipulation, things like that. We work on the joints. We have some fancy equipment like you can see here on the third from the left. That is an example of a E-stem, which is also very common in normal orthopedic physical therapy settings. So if you've ever had back pain or hip pain, sometimes physical therapy will prescribe that. Same thing can apply for pelvic pain as well as stress incontinence. So if you ever have leakage when you're coughing, laughing, sneezing, those are also some things that can benefit from the E-stem. The last point right here, this is kind of what separates us a little bit from everyone else in physical therapy. And we teach you how to sit on a toilet. So it sounds like it's a very simple thing, but the body mechanics associated with sitting on a toilet can really deeply impact everything that's going on down here. And I'll get into that a little bit more later. So here's your anatomy lesson for the day. On the left here, or right, you can see this is top-down view of a female pelvis. Now, it shows the female pelvis, but it is the same exact thing for a male pelvis, except there's not a hole right there. That is the only difference. It is a big muscle that involves tiny little muscles, and it all acts like a big hammock sitting on the bottom of your pelvis, holding everything up and in. Now, I have this picture over here because I have, we also have muscles that surround the pelvis. So they attach from, as you can see, the back and the hip. So where I was saying earlier that, we also treat low back pain and hip pain, that's because all those muscles right there. So these are the accessory muscles, the muscles that help out the pelvic floor muscles over there. Okay, and so then these are going to be two side views of the male and female pelvic floor muscles in general area. So on the left here, we see the female side, right? And I like this visual representation because it shows just exactly how close together everything is. This is all in the small area. And you can see, so we have the bladder right here, then we have the uterus, and then we have the rectum. So this is our bladder, sexual, and bowel function right there. And then in the red, surrounding it all, those are the pelvic floor muscles. So that's everything that's holding it quite literally together. On the male side, you can see the same exact thing. We have the bladder, the prostate, and the rectum. So bladder, sexual, and bowel function right there. And when everything's working right, we're like having a hammock. Nice, relaxing time. So I want you to imagine that the pelvic floor muscles are a hammock. You're laying there and everything's spick and span. You can relax. You don't have to worry about falling out or anything like that, right? Well, what happens when the hammock stretches over time, starts to sag? What happens when the opposite like you tie the hammocks too far apart and now the hammocks stick straight. Either case, you might fall. And we don't want that to happen to our organs. So the pelvic floor muscles are really important because it quite literally holds everything up and together. But the pelvic floor muscles aren't the only thing. Pelvic floor is just one piece of a big puzzle that we like to look at. So another big analogy that I like to say is that we are what we eat, and we can be a soda can. So if you imagine a soda can as from right here, from the bottom of my rib cage to my pelvis, this is how the system can kind of work. It's a pressure system. So the sides of the soda wrapping around right here, those are our core muscles. On the bottom here, right here where you see the top of the soda can, that's where our pelvic floor is. Then at the top or the bottom of the soda can, that's where our diaphragm is, and that's the big muscle that sits underneath the rib cage that's really good for breathing. Now, what happens when we have pressure on the sides of our soda cans? So this can be when we're coughing, laughing, sneezing, someone jostles you a little bit, stuff that happens in everyday life. Pressure goes to the path of least resistance. It's your little physics tip right there. So what happens? We have leakage. The liquid comes out of the bottom, and that's kind of where we come in. So we look at the entire system because the entire system needs to work in order for you to not have trouble with things like incontinence. And to kind of go over some more myths and misconceptions, because pelvic health can have like a certain certain stereotypes and stuff that can make it difficult for some people to come and see us. So there's a lot of different myths and misconceptions. But to start off, only women need pelvic PT. False. Very, very false. We see all sorts of issues in males just the same. Males can also have incontinence. Males can also have sexual dysfunction. They can also have bowel issues. It's all the same in that sense. Kegels fix everything. No, not always. If there's anything that you take away from this presentation is that I do not want you to necessarily go home and do a bunch of Kegels. Because I want you to imagine if I'm trying to strengthen my biceps and I have a hand weight right here, all right? Normally, when we have our full range, I can strengthen as much as I want, right, with the hand weight. Now, let's imagine that my muscles are really tight, like this, and I have a hand weight, and now I'm trying to exercise. I'm not going to do too much. Opposite, too. Let's say that I'm not really flexible, but let's say I'm very flexible, and now I can't move. So now I can only strengthen in this motion because I can't get the strength to get the full range, right? So both cases, opposite ends of the spectrum. You do Kegels, and I mean, it's fine, but it's not going to do anything for you. It's counterproductive. So that's why it's really important that you see a pelvic PT who can correctly diagnose you with what exactly is going on. Pain is normal with sex. No, can be a very common thing, but it is not normal in a sense that at any age, from when you're a young sprite in high school or all the way into your 90s, doesn't matter. Things like menopause can really negatively affect the pelvis in terms of pain, as well as chemo if you have cancer. All of these things that might lead to having pelvic pain with intercourse is something that we address. So even if you have it, doesn't mean that you have to have it. Problems after birth happen only during the first couple months after you give birth. That is also false because As some of you guys may know, after giving birth, it takes a long time to heal. And there's some things that last a lifetime afterwards. Things are never quite the same, right? Well, I can see postpartum patients, so postpartum being after birth patients, and there's 80s and 90s. It still counts because the problems that they're experiencing are from when they gave birth. And sometimes those things don't pop up until later. And then everything is loose after childbirth. Not necessarily. A lot of times, yes, but not necessarily, because sometimes the body reacts to pain by tightening up. So after you give childbirth, sometimes the pelvic floor muscles tighten up. Again, kind of going back on that point where I was saying, don't just do a bunch of Kegels, because again, it might not be doing anything. And don't assume that's what's going on with your pelvic floor, because again, it changes. It's different for every single person. Last but not least, it's a normal part of age. This one I get a lot. A lot of people are like, oh yeah, I just coughed and sneezed and I just had a little bit of leakage, but that's normal. That happens all the time. Well, again, common, but not normal. It shouldn't have to be normal. All these things that I've been talking about are things that we can address in different ways. So now I'm going to leave some time for comments and questions for everyone. So does anyone have any questions for me right now?
Thank you. So what are some common exercises to strengthen the pelvis? I mean, whether it be the muscles or joints or bones, I mean, they're all interplaying with each other.
So that's a really good question. And I'm going to give you a very broad answer because it depends. And it depends on what's happening, but in general, when I approach someone and they're telling me that they're having some sort of issue and the result is that they need to strengthen something, we look at the joints around the hip and pelvis too. Sometimes a Kegel is an answer. But in order to have a good foundation, you have to have some good bones as well, in terms of like having a nice, good core. So there's some exercises like a TA contraction, which is a transverse abdominis muscle. It's a muscle that wraps all the way around the body just like this. It's very deep in there, and that's a muscle that helps support everything. And if that's functioning, then more likely it's going to be, I think is the microphone on? Okay. So doing some core exercises that involve that, and oftentimes, again, it's a lot easier if you have a physical therapist to kind of make sure you're doing the exercise right. So I highly encourage you to make sure that you're doing the exercises right with a professional. But generally tightening the core, it's kind of like a sucking in motion. It's very subtle, and you're not going to feel like you're doing it. Another big thing is strengthening the hips, because the hips is what the pelvis sits on, right? So if the hips, any sort of good stability, strengthening exercise for the hips would be most likely beneficial. To directly strengthen the pelvic floor muscles themselves, that is what we call a Kegel. A Kegel, for those that don't know, a Kegel is a pelvic floor muscle contraction. It is the muscle that you squeeze when you're trying to stop the flow of urine as well as gas. Right? So if you're in a crowded room and you don't want to pass gas and you kind of tighten up a little bit, those are the muscles. Now, this is the key thing about a Kegel. If I can see any sort of movement, you're not doing it right. So I should not be able to tell looking at you that you're doing a Kegel. So if I can see you like tighten your muscles like this, then that most likely means that you're using like the other muscles and not the actual pelvic floor muscles themselves. Does that answer your question?
Okay, you're with Trinity.
Mm-hmm.
So, do you ride a circuit among the Contura CCRCs that use Trinity? And if somebody makes an appointment with you and they say, I've got issues with this, this, and this, how do people like you help determine, or not help, how do professionals like you determine what the problem is? Do you take x-rays? Do you do pelvic exams? Do you do whatever? And do you do that on site in your work as a therapist with Trinity?
Good question. So, my job here is a little bit different, right? So I'm a travel therapist right now, so I'm not working directly with pelvic health. I take contracts where people need me, and so right now we don't have a setup of specifically pelvic health in the Trinity Rehab Center, like here. What I will say is, I encourage you to try to seek out a pelvic health physical therapist. There are a lot of them in the Triangle area. I will also say that there are things that I can do in this setting that can still help diagnose things without it being a formal pelvic health examination. Because yes, we do pelvic health exams, internal and external. Internal is one that we reserve for specific clinics because we have to have formal consent and all of the stuff written down and a good place to be able to perform the pelvic exams without an audience, right? And so with that being said, we can also do external exams, which sounds funny, but basically what it is that I just look at you from the outside, looking at all of the different muscles in your hips and your back and your legs and your core, and kind of make an assessment based off of those findings that I find. I can generally find a good idea of what's happening when I look at it from that perspective. I don't always have to do internal exams in order to decide what's probably the best route to go. There's a lot of times too where if patients aren't comfortable with an internal exam, which is understandable, a lot of times the treatment starts off with just doing external work. Does that answer your question? Uh-huh. Correct. Yes, I would say you can call to see if what's available, and what we can do is more of like a consult where I can say, all right, this is an issue that I can probably address here and externally. And if not, then I can tell you guys like, okay, this is something that would need more of a thorough examination. So, and refer to another location that might be more helpful. Mhm.
Now I've forgotten. Oh, for people who are on traditional Medicare, they can self-refer to a therapist. Advantage plans may require an internal within the Advantage gatekeeper referral of, but for those who are traditional Medicare, can they self-refer, or can you only see people who have been referred to your specialty by a physician of some sort?
It is just like any other physical therapy. If, from my understanding, you don't need a referral if you have Medicare. Um, I am honestly not that great with insurance. It's all very confusing. But when I was working at an outpatient pelvic health, anyone could just call up and say, like, hey, I need an appointment or I want to be seen. Some insurance might differ. And if that's the case, then just having a quick phone call with your primary care and have them send a quick referral.
So because you're not always here, might you do an assessment and then we would be followed up by another PT that's on campus more? Or would you always need to be working with someone who's specially trained in pelvic health?
That's a good question. So it depends on the therapist. When we graduate physical therapy, we have a general degree in physical therapy. So that means I can see anyone of any population in any specialty. However, some therapists might not be comfortable with it. So it depends on the person. Like if you sent me to go do a pediatric neuro assessment, I would be like, what? Like that's not I exact opposite of what I usually do. But with our degree, we can see anyone. And when I do a formal assessment and I come up with a treatment plan, those are things that I can relay to my coworkers and say, like, okay, this is what I found, this is what I'm thinking, this is probably how they will benefit. And a lot of times the strengthening exercises and other things are similar to what you would see in other issues, other orthopedic issues. Um, it, uh, it just depends on the therapist, on the person. Does that answer your question? Okay.
So if one of us here decides, so if one of us here
Mhm.
listening to you decides we need to do something, or this is a good opportunity for us to follow through on,
Mhm.
what would we do? First thing we would do would be what?
Mhm.
Call Trinity?
Yes, so you call our rehab office at our extension 8222
Mm-hmm.
and talk to Kathleen. And Kathleen can help set up the appointment, and she's in
And the
charge of all the.
appointment would be with you for an assessment?
Mhm.
Okay.
Yeah, you would just let her know that, hey, I want a physical therapy assessment with Melanie.
Okay. Then you would refer us to somebody that would work with us with the exercises.
Yes.
Okay. Right. Thank you.
There are also some handouts that I have that are generalized that I will talk to my coworkers about and like talk through. Um, some things that aren't necessary exercises, but they're techniques that are used to help with some of the issues, common issues. Um, so those are also things that you can like ask about if you can't get a hold of me.
So to
this is a general question. I mean, I've often thought that the uh, Trinity or whatever the name was before that should have these type of sessions for us. I mean, there's a lot of specialty and generalities that you could share with us. So, this this session. This is the first that I know of, but
Hmm.
is this going to continue in the future with other parts of the anatomy in terms of information sharing and what we can do to improve our health
Hmm.
and also on recommendations?
That is a good question. I will have to refer to Kathleen when she comes back from vacation, but I would certainly love to have another session.
Yeah, well, tell Kathleen that Salarito said, just do it. Because, well, we have, in addition to this, the only other sessions that I know of, and I'll stand corrected, is with Jill Davis from Humana that actually has spoken on health issues. And it's been so rewarding. And I've seen the same number of participants. And for this is a good turnout for us,
Mm.
believe me. And I just would encourage it. You know, there's so much at this point in our lives, things that we need to have more information about. Some things we may be doing wrong. You know, we think we're getting a personal trainer and that we're going to jump up like, beans and stuff and it's going to help us. But there's a lot of things that we can do that can actually be hurting us too.
Hmm.
So this is the kind of session that I think will really help us and I encourage it going forward.
Yeah, I would agree. I would love to have another session to go more in depth. I only have 15 or 20 minutes to explain a whole field that I've been studying, years for. So,
You may not realize it, but there's a lot of people watching you on the video, or whatever we call this. Thank
mhm.
you, in-house TV, and so don't think this is just who's watching you.
Oh yeah. No, I'm aware.
It,
Hello.
it's a really really big deal for us. And I
Yes.
do have a question.
Yes.
You sort of skimmed over the
Mhm.
fact that there's a certain way to sit on the toilet.
Oh yeah.
I'd like to know what the correct way to sit on this toilet is. I've never even heard of that.
Oh, okay. That's a really great question, and that's something that is pretty uh, safe in terms of like everyone can benefit from. If you have ever heard of a squatty potty, have you guys heard of a squatty potty? Well, yeah, sort of. So, a squatty potty, and it doesn't have to be an actual squatty potty, it can be anything that you can put your feet on. But if you can get into a position when you're sitting on the toilet where your knees are resting above your hips. Yeah. Makeshift toilet. All right. So, to kind of continue my anatomy lesson, we have this muscle that wraps around where our rectum is, and it acts like a sling. And when we're in this position where we're sitting on the toilet and our knees are below our hips, we get into what we call an anterior pelvic tilt. So that's when your butt's sticking out like this. And when your butt's sticking out like this, that muscle is tight and it's tight around the rectum. So what it does is it quite literally kinks off the area and makes it harder to go. So when you get your feet up like this, suddenly your pelvis is in a rounded position. And then that muscle relaxes and it makes it easier to go. And why that is so important is because if we strain when we're pushing, when we're trying to go to the bathroom, whether we're trying to go to urinate or have a bowel movement, either way, it puts a strain on those pelvic floor muscles and it can make an issue over time. So with having it up like this, it puts you in a better position, and you can use a step stool. It doesn't have to be a squatty potty, but I like to say squatty potty. And I will also encourage you not to have your feet up on your tiptoes like what I'm doing, because here I'm not relaxed. My pelvic floor muscles are tight because I'm trying to hold everything up, right? So that's the key, is having a stool or something so you can rest your feet so everything relaxes and it's much easier to go. And then just to add a little extra bit of fun to this, when you are having a bowel movement and you are pushing, breathe. If you're breathing, you're not straining. That's a good tidbit. And if you're not straining, then you're not causing any issues, right? So generally what we do is pure slip breathing. So that's when you're trying to like blow up a balloon. You do. I didn't want to do it into the microphone because that would have been loud. But yeah, so the basically just having your feet up above so that your knees are higher than your hips puts you in a better position and makes it easier to go. Does that answer your question? Uh-huh. It yeah, sorry.
So I think in the picture we saw, I think the man is actually coming over with
Yeah.
his arms on the. Is that positive or is that something that's tightening things up? Sorry, is that sorry? You can't hear me now. In the picture we saw at the beginning,
Mhm.
the man is on the toilet and he's leaning over with his elbows on the tops of his legs.
Mhm.
Is this good or is this something that we should not do?
Excellent question. So this is, and you're gonna love this answer. It depends. So, um, it is still much better to have the stool underneath you. However, sometimes this position, if you're like in a public restroom, because public restrooms do not have squatty potties, then you can kind of get into that position. However, pay close attention to what your back is doing. Make sure that your back is rounded, not flat. And that can help.
Some seniors, or anybody, I guess, gravitate towards a commode that's called a high boy
Mhm.
or that's higher
Mhm.
because of it helps them stand up and sit down, I'm
Yes.
assuming. So therefore, it sounds like a high boy is not the way to go because that makes the knees in a different position compared to the hips, if you follow my drift.
Mhm.
So are high boys therefore not really recommended?
Not necessarily. So, high boys are really important for people who can't or have trouble getting up from lower surfaces. And I would much prefer you be able to get up from the toilet than having the knees above the hips, right? So that's where something like a stool or a squatty potty kind of handy in your bathroom, because I don't have a picture of a squatty potty, but a squatty potty is like a U-shaped stool, and it sits underneath the toilet, and you can bring it out and then put your feet on top of it. So sometimes what I recommend for people who have higher toilets or need higher surfaces is to have a stool or a squatty potty nearby and try to get it in front of you while you're going, and then take it off and take it away before you get up. Hmm. Exactly, yeah. It depends on how tall you are. As long as your knees are above your hips. If it's a high boy, it might need to be a little bit taller, but it also um, keep in mind that it might be difficult to kind of like organize it all. So, like if you have a really tall stool, being able to drag it over underneath you would also be difficult. So, you have to find this nice balance. And sometimes, even just having a regular sized stool where maybe if you have the high boy, it only gets your knees to the height of your hips, not further, then that is still a better position than with your knees below your hips.
You make a fat boy work out this morning.
I wouldn't say it that. Okay, so this is an ignorant question, my own, but so talking now, it's high boy and whatever, which I don't know a lot about, but what you describe it almost seems like there should be bars. So when a person is getting down, they hold on to the bars and then lower themselves, and they use the bars to lift up. It's an ignorant question. Is there something like that? I mean, it seems like the high boy is controversial. I mean, it helps in one way. Okay, but that's what he showed me is a whole unit. But I rather than yeah, okay, so there is.
And
So
it's a mechanism that will pull you up and down.
Mhm.
It's like a lift chair.
so I don't know if everyone can see it, but that's
That's on the way
extremely
there.
useful to for people as we get older and we have trouble getting down and up off the stool. So I
There
mean
you go, my
the
friend.
toilet bowl.
You know, I should have brought my squatty potty. That's what I really should have done. But
Well, it's amazing. I give her courage for asking a question because that's not a typical question that people would be, people would be embarrassed to ask, how do you properly sit? Because, well, I was scanning the internet and I came across an article that says how to properly sit on a bowl to poop. And I said, what? This is ridiculous. But I read it. And you know what? The ridiculous was not the article. The ridiculous was me because I actually learned how to properly stew, and it also helps you go
mhm,
faster because as opposed to just sitting there.
mhm,
And for my service days, I won't say where, but sitting, digging a foxhole and stooping down and straining gives you other complications.
mhm.
So, um,
Yeah,
but,
and that's the other thing too. The key about relaxation, if you're thinking about like when you're squatting over a toilet um, or a hole, then you're still your pelvic floor muscles aren't relaxed, right? Because you're not relaxed. So the key is to have that relaxation, and with having a higher surface, whether it's a higher toilet, the high boy, or a commode that sits over the toilet, either case, um, just having something that you can pull in front of you is something that if you can try it safely, right? If you feel like you can't organize it all, then I would much rather you have the high boy and not a squatty potty than the opposite.
and if you've ever been to the rural areas of Asia, whether it be Vietnam or China, and you have to go to the bathroom, you have to know how to squat.
Mhm.
So,
Do you have the handouts for us today?
I did not have them because I didn't know which ones that would be people would want. Yeah, what people would want because there are quite a few of different ones. So what I can do is go and print a bunch of different handouts, and then um, I can leave them at the desk for you guys to take a look at. And if you have any questions whatsoever, just don't hesitate to stop me in the hall and be like, okay, well, what did this mean?
Do you have any cards with you?
Cards?
Your business card.
Oh, that would be a great thing to have too. So let me have that right next to the handouts. And some of the handouts will include, they're just going to be broad strokes, right? Again, I can't emphasize it enough that you guys reach out to either it's me or someone else who specializes in pelvic health to make sure that you're gearing your efforts, treatment, exercises towards what you need because it's different for everyone. I'll just give you a quick example of what technique we can use. That will be a handout that you guys can see, and I'll do the urge suppression technique. So the urge suppression technique is something that I use for people who have a really strong sense of urgency, and it's also useful for nocturia, which is frequency at night. So if you get up 2 or 3, 4 times a night, this is a technique that can be very helpful in that regard. And generally across the board, it's helpful no matter what specifically is going on to you. But still, reach out to someone to make sure that you feel comfortable with it and that it's working for you. And questions often do come up. But like an urge suppression technique, for example, in the handout, it'll say 4 big steps. When you feel the strong urge or when you wake up at night, stop. Don't go to the bathroom yet. Breathe. Take 4 or 5 big, deep breaths. 3, try to do some Kegels. Kegels, not squeezing your thighs. Kegels, difference. 4, go slowly to the bathroom. Don't rush. Never rush to the bathroom. Even if you have the strongest urge ever, you stop, repeat the process, and then try to go slowly to the bathroom when the urge comes down. Why this is so important not to rush? Falls. That is one of the biggest problems, especially in a 65 plus community, is rushing to the bathroom and falling. Now, I will ask you guys this. Would you prefer to have leakage or prefer to have leakage and a broken hip? If you rush, you might make it to the bathroom and you might not have leakage, but you have a very strong possibility of falling. And if you fall, I guarantee you will leak. So you're going to have the very thing that you tried to stop happen. So if you try the technique, which I'll have a handout for, and I'll print it out and put it at the front desk, along with a business card, then when? Well, I have a time at noon, so I will probably print them off at noon and then bring them up to the front desk around that time. And I can stick around there for about an hour if you guys need, if you have any other questions about them. So, yeah, that's just an example of a technique that can be used that's generally helpful for most people. Any other questions? Yeah, yeah, yay. Thank you. Thank you. Yep. So, yeah, I'll be at the front lobby around noon with some handouts if you guys have any other questions. Thank you so much.